Thank you everyone for being here. My name is Criosa Michelazzo. I'm the Director of Strategic Partnerships with the Tech Collective. And today we are in for another wonderful treat. You all are here to listen and learn from Karyn Rhodes. Karyn brings more than 30 years of senior level experience in human resources, best practices to complete payroll solutions, where she serves as the Vice President and Director. Karyn specializes in areas of human resources, including strategic planning, employee and labor relations, recruitment, compliance, training and development, compensation and benefit policies. You are in for a treat. She's an amazing presenter. She would answer your questions, even the ones you didn't think you had. So with that, Karyn, I pass it to you.
Thank you so much. I appreciate the introduction and nice to be here today with all of you at Tech Collective. So I'm just going to share my screen with you. So bear with me 1 minute. Okay. All right. So COVID-19, as you all know, we're still dealing with this awful virus and now variants coming out. And, you know, it's great news that we're moving forward with vaccines and the country is moving forward. We still are daily having calls with companies with exposures in the workplace, sick employees. Fortunately, a lot of the layoffs and furloughs have slowed down, which I'm very excited about. And I am starting to see people hiring again. So we're definitely getting to a better place. And as I've told folks in the past, things are changing again so quickly that I put the slide deck together, and now I just got an update early this morning. So I'm going to be sharing the information with you on the update that I just got. So we're going to talk about employees returning to work, vaccine basics. Again, I'm not a doctor, but we're just going to go over what the vaccines are, pros and cons. Should you mandate it or should you recommend it as an employer? This is a really important area for us to cover. Also accommodating exemptions to the vaccines, people that can't get it or don't want to get it. Focus on independent contractors coming out of the new administration. We need to talk about that. And this OSHA COVID standard, which most likely will be released by FedOSHA in the next couple of weeks, and it's going to apply to all employers. So when can my employee return to work? So finally, our conversation is, you know, can we ask people to come back into the work environment? How do we do it safely and all of that sort of thing? So this is from the Rhode Island Department of Health. Of Rhode Island workers who tested positive for COVID, more than half reported going to work while sick. Just think about that for a minute. More than half reported that they were sick and in the work environment. So we definitely do not want people coming into work while they're sick and spreading this to other employees. We want to keep our workplaces as safe as we can. So when can somebody come back to work after they've had the virus? Again, this is according to the Rhode Island Department of Health and the CDC. After testing positive and completing isolation, they are not recommending a follow-up test. And we do get that question all the time. I want my employee to be tested before they come back into the workplace so I know that they're negative. Well, that's not going to result in a good outcome because most likely those people are still going to test positive even though they're no longer symptomatic. So we don't recommend you requiring a test to come back to work. These are the areas where we're focusing on. If somebody's asymptomatic, they can come back to work. At least 10 days have passed since the date of the first positive test, which is the date you were tested, and no symptoms have developed throughout the 10 days. You can return to work after that time period. If somebody is symptomatic, at least 10 days have passed since symptoms first appeared, and at least 24 hours since the last fever without fever-reducing medication, and the symptoms have improved. Return to work, immunocompromised, at least 20 days have passed since symptoms first appeared, and consultation with a medical provider. So that's when people can return to work. Now, generally returning to the work, if you are having employees work remotely, I would be very cautious and I'm not like turn a switch on, everybody's back in the workplace. I think we're going to be seeing a hybrid approach, some people returning to work a couple days a week, and so on. You should have somebody in the work environment that is monitoring who is in the workplace at one time and make sure that they're still spread apart. This will change as more and more people get vaccinated. We can bring more people to the office, but we want to do this very slowly and methodically and make sure that somebody is managing that. So according to SHRM, a recent survey, and of course these numbers are changing all the time, but a recent survey, 60% of workers will probably or definitely get the vaccine once it becomes available to them. I am hearing that more and more people are saying now that they will get the vaccine. Nearly 24% of employees who are not planning to get vaccinated are saying that they would change their minds if their employer offered an incentive, such as a cash bonus, a stipend, PTO time, or a gift card. And we're going to talk a little bit about incentives. 12% would be willing to get vaccinated only if they might otherwise lose their job. So we're going to talk about that. We have to be very, very careful if we decide to terminate someone because someone is not getting vaccinated. So that is definitely, if you're going down that path, you will want to consult with a senior HR professional or legal before you take any action such as that. So the vaccines that are currently available, the mRNA, messenger RNA vaccine, of course, you know, Pfizer has come out with a vaccine and Moderna. Most people know that. As you know, it needs cold storage. It's unclear if it is effective against variants, but we're optimistic that it is. So we don't know at this point if we're going to need a booster down the road. Most likely we will at some point. Soon to be here, so they're working on viral vectors, injection of modified harmless virus to trigger the immune response. The Johnson & Johnson is here, as you know. AstraZeneca. Johnson & Johnson, as you know, does not need to be cold storage, and it's one vaccine. AstraZeneca, we're hearing from Europe right now that they're putting that vaccine on hold because they are seeing some clotting issues and so on. We will be coming out with more vaccines. Protein use part of the virus, Novavax, the phase 3 trial has ended. They're also now studying pregnant people, vaccine use, and also children 6 months and older, which is very good news. So the emergency use authorization. This is the FDA mechanism to approve medicines during public health emergencies when there are no approved and available alternatives. As you know, this is what we're facing right now. So the analysis that they use for an emergency use, when the benefits of therapy outweigh risks and the product meets reasonable thresholds for safety and effectiveness. So that is the analysis that they did with pushing through these vaccines under this emergency use. The vaccine benefit definitely is outweighing the risks of not having it. The analysis that they do is based on evidence at the time that they have without waiting for all the evidence that would typically be needed for FDA approval. I'm sorry, there's a typo there, FDA approval. The public must be given the option to accept or refuse a vaccine and consequences, if any. If refusing it, what alternatives to vaccine are available? And again, benefits and risks. There has to be informed consent if you're doing it at the workplace. So the authorization is temporary, this emergency use, and only lasts as long as the state of the pandemic is in effect. So there is actually some court cases back to support this. U.S. Supreme Court, this was in the case of Jacobson versus Mass, and this was in 1905. A Cambridge man was fined $5 for refusing to be vaccinated against the smallpox. And they stated that states are actually permitted to enact public health laws and mandate vaccines. Now, we haven't seen that happen yet, and it will be interesting to see how the states come down going forward. But they found in this case that persons and property are subjected to all kinds of restraints and burdens in order to secure the general comfort, health, and prosperity of the state. Upon the principle of self-defense, of paramount necessity, a community has the right to protect itself against an epidemic of disease which threatens the safety of its members. So we have this benchmark case that would be probably brought up and considered if states decide that they are going to mandate vaccines. Now, when we have people coming into the workplace that are not vaccinated, this is the threshold that is going to have to be considered. Whether that person that is unvaccinated poses a direct threat to the work environment. So it's known that even if you have 20 people in your work environment, 17 people are vaccinated, you have 3 people unvaccinated. They could still spread the virus or a variant to the vaccinated people and potentially take down a whole team. Now, those vaccinated people will probably not be affected as significantly. They probably will not die or have, hospitalizations, but they still could catch the virus and need to be home, for 5 days or whatever it is to get better. So this is the consideration, and there's a 4-factor list that employers are going to need to consider. Number 1, what is the duration of the risk that person or people pose? What is the nature and severity of the potential harm? So we do know what the severity is with COVID. What is the likelihood that the potential harm will occur? And what is the imminence of potential harm? We all know how quickly this spreads, and we're hearing the variants are spreading even faster and can be even more serious. So, a direct threat of somebody coming into the workplace that has not been vaccinated could be considered under this. The EEOC is determined based on the best available medical evidence from the CDC, the public health agencies, and so on. What is the severity of the pandemic in your location? I know that our rates are dropping in Massachusetts and Rhode Island and the Northeast, but is there an outbreak that's going on? So that would be considered, and you'd consider the individual's employees' health challenges and job duties. Now, we need to be very, very careful about asking people why they're not getting vaccinated. We kind of don't want to go down that rabbit hole because it opens us up into a bunch of legal issues. So we have to be careful with that. So guidance from the EEOC, again, this was in December of 2020. The EEOC is saying a vaccine is not a medical examination, so it's okay for employers. Now, employers at this point, to my understanding, cannot get the vaccine. It's being set up at clinics. Eventually, they may be able to get the vaccine and administer. They will need to be careful about any pre-screening questions that they ask. Again, you're going down into this legal hole, so we want to be very careful about questions that we're asking. Employers can ask for proof of vaccination, but again, we need to be careful about follow-up questions. So they can ask for proof of vaccination. They can actually take a copy of your vaccine card. If you decide to do that, you want to keep it in a confidential medical or HIPAA file, and only one person has access to that file. We certainly don't want to ask somebody if they've not been vaccinated, why haven't you received a vaccine? Again, that's getting into a very dangerous area. If an employer requires and administers the vaccine, again, this is when the employer is doing it themselves, they must show unvaccinated employees pose a direct threat, that person potentially can expose others to the virus at work. We cannot exclude unvaccinated employees from the workplace under the direct threat analysis unless there's no way to provide a reasonable accommodation without undue hardship. Now, so somebody's not vaccinated, they come to us, they say, no, I didn't get the vaccine, I'm not going to get it. We need to go down that reasonable accommodation process and see, is there a private office we can put that person in? Can they continue to work remotely? Is there a way for us to accommodate them so that they don't come into the workplace and potentially spread this to other employees? So we need to consider that very, very carefully. And again, if we're unable to accommodate that person in the workplace, I would strongly urge you to contact either my team, contact legal counsel, because now we need to figure out if there's no accommodations, it creates an undue hardship for the employer, and we may need to go down that path of separation. Again, be careful about termination, even if no accommodation due to a disability or a religious accommodation, or maybe a pregnant employee. No direct threat analysis is required if the employer requires employees to be vaccinated, a pharmacy, healthcare provider, or vaccination is voluntary. So engage in the disability or religious exemption analysis. Again, this is under ADA and Title VII of the Civil Rights Act. Employers need to determine whether an employee who qualifies for a vaccine exemption can still work at the worksite, just as we just said. So you could have somebody that has some kind of a medical condition and cannot get the vaccine because of that. or it's against their religion. You're going to use that interactive process, ask them why they're, so if they say to you, I'm not getting it because I've got a medical issue, we want to get into that interactive process and see if we can reasonably accommodate them. And again, these are possible accommodations: working from home. They have to continue wearing a mask and be social distance from other people, wearing PPE at all times. You may be able to temporarily transfer that person to another position, or you may be able to provide them with PTO or time off so they can look for a new job. Now, potentially, again, using that 20 people in the work environment, you have 17 that don't need to wear a mask, don't need to wear PPE or be socially distanced because they've been vaccinated. You have 3 people that are still required to wear masks and PPE because they have not been vaccinated. You can imagine that a few of those people may then be changing their minds and deciding to get vaccinated because they don't want to continue to wear a mask or be social distance from other people. So it will be interesting to see if people decide to change their minds on that as we go down this path. So the question whether employers should mandate the vaccine or not. Generally speaking, if you are outside of a medical business like a hospital or doctor's office, nursing home, I would be very, very cautious on mandating vaccines. Our recommendation is that employers strongly recommend that their employees get vaccinated, but stay away from mandating the vaccine unless you are in one of those, again, businesses that medical, even nursing homes we talked about, but prisons, it would make sense to have a mandation policy. So the federal and state laws don't prohibit an employer from mandating that employees receive vaccinations. So they don't prohibit it, but again, should you do it or shouldn't you do it? Our recommendation is that you strongly recommend. So COVID-19 has been determined to be a direct threat by the CDC. So that's coming from the CDC. So we know that people are not vaccinated would pose a direct threat possibly to the work environment. An unvaccinated person could potentially be excluded under the EEOC, ACA, Title VII, and the reasonable accommodation guidance. OSHA also requires a safe and healthy work environment. So again, we could run afoul of OSHA if we're letting people that pose a direct threat into the work environment. A requirement could increase employee comfort level by creating a safer work environment. So we may feel safer if everyone is mandated to get the vaccine. However, if you're mandating, consider if it's consistent with state or local laws, the emergency use authorization status of the vaccines currently available in the US. If you decide to mandate, will it expose an employer to workers' comp or another liability if an employee has an adverse reaction? Can they actually file a workers' comp claim? Most likely they can if you're mandating it. If you're unionized or you have a CBA, does it even allow you to mandate vaccines? So you'd want to check that very carefully. Privacy-related concerns involved. Putting aside any potential legal issues, employers should consider potential employee relations and workplace morale if you decide to mandate. And the need for safety protocols remain in place. So the CDC has been very clear on this, that even if people are vaccinated right now, they are advising that we continue to wear masks when we are in public and we continue to socially distance. So rationales for recommendation of the vaccine. Questions around mandating a vaccine that is subject to emergency use authorization but not full FDA approval. So there's still questions around that. Employees' resistance or fear. If you mandate that people get a vaccine, it could backfire on you and reduce morale. Potential side effects of the vaccine could lead again to workers' comp claims. I'm sure you all are hearing also that the Moderna second dose does have some side effects with some people. So potential side effects could lead to those workers' comp claims. The risk of claims of discrimination or retaliation. Encourage vaccination for the greater good of the organization and larger community. That is our recommendation. Just make sure you're aligning whatever approach you take with your organizational culture. So pregnancy has not yet been formally studied. I am hearing of studies starting out of the UK. Some trial participants became pregnant during the process and they've had no adverse effects so far. Pfizer is about to enroll 4,000 women globally, so that just started, I believe, this last week. Is fear of the unknown effects on a fetus a valid reason to refuse a vaccine? We don't know that yet. So we need to just be cautious with people that are pregnant. And already a first case, a waitress in New York City was fired for refusing a vaccine as she was contemplating pregnancy and concerned about the effects. Vaccine reactions and sick time. So again, I have some information hot off the press here, but employers right now with the new stimulus have the option of extending FFCRA leave until September 30th, 2021. FFCRA did expire December 31st, 2020. The next release of the PPE extended that voluntarily until March, the end of this month. You could extend that voluntarily, and now from April 1st until September 30th, you can also extend this on a voluntary basis and get the tax credits to pay for this. So if people are getting sick, need to quarantine, they can use this time. And also the emergency FMLA time can also be used during this time. So new and hot off the press, that leave to get the vaccine and reactions to the vaccine are now covered under emergency paid sick leave. So if you need to use time, or your employees need to use time because they're having a reaction and they need to be out of work for a day, or they need to go get the vaccine, you can use this emergency paid sick leave and get a tax credit to pay for this on the back end. Okay, so time can be used, again, this is April 1st to September 30th, 2021. Employers also can grant employees time off. They may pay employees to get the vaccine or incentivize employees to get the vaccine. So be cautious about paying people to get the vaccine, your non-exempt employees. There are cases popping up now where Sally takes her 6 hours to get the vaccine, so we're paying her for 6 hours of time, and Ben takes just an hour and we're only paying him for an hour of time. So there are some discrimination issues that are popping up. If you are going to pay people, you may want to create a policy that you will pay, say, for 4 hours of time. Another caution that you want to think about if you're paying people, that if that person gets into a car accident on the way to get a vaccine, it could be a workers' comp case. So just be cautious about that. You may want to think about granting unpaid time, allow people to get the vaccine, so consider that carefully. Employees could also use sick time or PTO to attend vaccine appointments, or if they're feeling too ill to work after being vaccinated. So hot off the press here with this time, the amount of wages for the family leave credit is increasing to $12,000 per employee. It was $10,000. And also the 10-day per employee limit on claiming the credit is going to reset on April 1st. So April 1st to September 30th, you can give an additional 10 days under the emergency paid sick leave and get the tax credit. Again, this is done on a voluntary basis, but I strongly recommend that employers grant people the time. You do not want sick employees coming into your work environment and spreading this to other people. Can I ask my employees if they are vaccinated? Yes, you can. You can ask them, and I would recommend that you most likely will ask them if they're getting vaccinated. So the ADA limits an employer's ability to inquire about an employee's disability. So we don't want to be asking people. But the EEOC has indicated that asking for proof of a vaccine is not likely to elicit information about a disability, and they say it's not a disability-related inquiry. So you probably all are going to ask your employees if they're vaccinated. You can keep a copy of the vaccine card. Again, you want to keep that as confidential as you can. It should be under lock and key in an employee's HIPAA or medical file. And those medical files should be kept outside of the employment file. All right, so you should have a couple of different files, but a medical file is one of those. The EEOC guidance also indicates that employers will need to demonstrate that any follow-up inquiry is job-related and consistent with business necessity. So make sure, you know, if you are inquiring, that you follow those guidelines. Don't ask follow-up questions that could get into that disability related area so that people are disclosing things to you. You don't want to get into that area. Again, if you want to get documentation from people, you certainly can do that. All right. Consider whether vaccine information will be secured and or distributed. Are you going to distribute out to your employees the locations where you can get vaccinated? I know Massachusetts and Rhode Island both have vaccine sites. You can certainly send those to your employees so that it's easy for them to find how to sign up to get a shot or a vaccine. So handbook and pandemic policies, our recommendation is that you keep any pandemic policies separate from your handbook. A lot of employers are saying that they want to include them. We're not advising that because you don't want to be changing your handbook constantly. So keep those policies separate. Hopefully they're just temporary. Ensure employees are observing pandemic health and safety protocols. As I mentioned earlier, and we'll talk about again, Federal OSHA is about to release an emergency guide that all employees are going to have to put in place, all employers. And part of that is a Whistleblower Protection Act. So if somebody's coming into the work environment and they're feeling that the employer is not doing enough to protect their safety, they are going to be able to complain to Federal OSHA, and there could be an audit done, fines are going to be levied, and so on. Getting back to the vaccination, set the expectations. What are your expectations about the vaccine? Keep in mind, again, those exemptions and any accommodations. Consider your work from home policies, hybrid models. What is that going to look like? I would think that it's going to be changing as the year goes on and maybe more people are getting vaccinated. I know a lot of employers are telling me that they're never going back to everybody in the office again. They're considering a lot of people working remotely. It's saving money and time in commuting. So I would imagine that most employers may do a hybrid model or just having people come into an office environment when they need to have meetings and so on. We're recommending that all employers continue to watch travel and quarantines in different states. And the expense reimbursement policies, make sure you're reviewing that. With a work from home environment, make sure that it's very clear on what you will cover, what people can expense and what they can't. So you probably have seen, I know I have seen some people who are hesitant about getting a vaccine. Some people have concerns about what the side effects may be. Other people have a wait and see approach. I'm going to see if people get sick and then I'll consider whether I get it or not. Some people, as you know, have a distrust of safety or the government, and so they're not trusting the government. Other people feel that others need it more than I do. You know, I'm sort of in that camp myself. I'd like to see people that have more issues get vaccinated prior to myself, but then I will be getting vaccinated. Nearly 70% of employees who probably or definitely won't get vaccinated said no amount of incentive would convince them to get the vaccine. This is according to SHRM. So can you provide incentives to your employees so that they get the vaccine? The answer is yes, you can, but it has to be nominal. It has to be a nominal amount, so it cannot be an excessive bonus or something like that. You could do a small cash incentive or a gift card, a little bit of extra PTO time, paying for vaccines. We talked about this already, how many hours you should pay. How to handle employees who have a valid exemption. So these incentives are have a direct line to sort of a wellness plan at a company. So we have to be careful on how to give incentives. People that have a valid exemption to the vaccine, they could have an underlying medical condition. It could be a religious exemption, a pregnancy, would still need to get the incentive. So we cannot withhold that from those employees, right? You know, maybe it's appealing to the collective good. It's good for our business. It's good for our country, and we should all be getting this. Or maybe you have a better approach in mind. So can you terminate someone who refuses to return to the office? We touched on this before, so probably, but use caution. We need to be very careful here. It's going to depend on the reason underlying the person's unwillingness to return to work, or who refuses to get the vaccine and so on. We know that we've had a problem with the $600 extra on unemployment, people wanting to stay on unemployment instead of coming back to work because they're making more money. Now they're getting $300, so it's not quite as much, but that could still be a problem. So we just want to be careful on people who refuse to come back to the office. Employees should provide the reason for declining in writing so the employer can fairly and accurately assess the refusal. You would hold on to that in the employee's file. Some people out there have generalized fear, anxiety, or desire to avoid COVID while commuting or working, or their loved one may have some significant underlying reason and they're afraid to work because of that. So we do have to consider those cases very carefully on an individual basis. So I don't want to make a generalized statement here because my team really needs to understand the entire issue that's going on and why the person does not want to come back to work. As you know, a lot of people are having childcare complications. It could be a family obligation due to closed schools or daycare providers. I do know, and I'm hearing as you are, that we're trying to get the children back into school by a certain date. There's a little bit of push and pull with that, so we'll have to see what happens there. Other employees or their family member may have medical conditions, as we mentioned. So we need to see if we can reasonably accommodate those people, maybe by working from home. So this whistleblower retaliation will be part of the Fed OSHA plan that's coming out. Even prior to that, it's a big area of potential liability for employers. So if an employee is filing a complaint or bringing a complaint forward, saying they're concerned about their health and safety, that the workplace is not safe, maybe they're seeing people walk around without masks on or not social distancing, and they bring a complaint forward, you need to take those complaints very seriously. OSHA is going to take them very seriously, and there are going to be fines, there could be audits in place, and it will be part of this new Fed COVID plan that's coming out. So just an example, an employer needs to be careful about disciplining someone who refuses to report to work after complaining about a coworker failing to follow social distancing requirements, or about customers failing to use hand sanitizer, or maybe wearing a mask when they come into the business. Another example could be an employer's decision to terminate a manager when the manager notified a regional manager of PPE shortages. So if people are coming forward with complaints about safety or health, lack of PPE, we need to be on top of that and making sure that we're addressing those needs and trying to solve whatever concerns people have. So new from the CDC, this is new guidance that you might have seen. People who are fully vaccinated against COVID can gather privately in small groups now without masks or physical distancing, relaxing safety guidelines for inoculated individuals under some circumstances. However, people that are fully vaccinated right now should continue to wear the masks, keep their distance from others in public or while visiting anybody that's unvaccinated and at higher risk. Vaccinated people, as we mentioned, can still get infected by the virus and transmit it to others who are at risk. I certainly have heard people saying, well, they've already had COVID, so they're not going to get the vaccine. People are getting COVID again. We've seen many, many reports. We're working with many nursing homes. People are getting COVID a second time, a third time. So there's no inoculation if you've had it one time. Early research suggests that vaccines are likely to make people less vulnerable to infection and less likely to spread the virus, which is very good news. Again, these numbers keep changing every day, but as of March 9th, more than 90 million vaccines have been administered across the US. More than 17% of the US population has received at least one dose, and 9% at least 2 doses. People are vaccinated 2 weeks after receiving the second dose or after receiving the single dose of the J&J vaccine. So it's a 2-week waiting period, and then you should be fully vaccinated. People who are fully vaccinated can visit with unvaccinated members of a single household without wearing masks or maintaining social distance, as long as those people are at low risk for severe cases of COVID. And who knows, right? I think that we're seeing healthy, strong people now facing severe cases of COVID. So it's hard to guess who's going to be severely impacted and who's not. Vaccinated people are less likely to get infected eating indoors. So if you have been vaccinated now, yay you. You can go to a restaurant, maybe take a vacation somewhere, going to the gym, but still follow safety precautions. So still be careful. Everyone still, even if you're vaccinated, should avoid large gatherings. So, you know, I know the vacationers down in Florida now, we're seeing those reports coming out of huge crowds of people. So the CDC, Department of Health, is still recommending that we avoid those crowds even if we're vaccinated. And the CDC is saying, again, the director, now is not the time to relax. Critical safeguards we know can stop the spread of COVID in our communities, not when we're so close. So we are seeing what's happening in Europe. They have another wave going on. Italy just went down into another lockdown. We certainly want to try to avoid that in this country right now as we're gaining so much ground on getting folks vaccinated. So we definitely want to focus on that. Coming out of the new administration, there is some heightened focus on employment laws. So we have, as we know, a new labor director who's very unionized, focused on union. We are seeing and we expect to see some additional union activity. So if you are hearing of anything, please contact us or an employment attorney who is focused on union activities, you know, for guidance in that situation. So focus on independent contractors. As we know, this is a huge area that the Department of Labor and the IRS come down on. Well, they're trying to put more teeth into this. Basically, the Department of Labor feels that almost everybody should be a W-2 employee. There's only a few cases where employers can really hire someone on an independent contractor basis. So there's an economic reality test. A person can be considered an employee, and this is quote, if a matter of economic reality, the individual is economically dependent on that employer for work. So two core factors here. What is the nature and degree of control over the work the employer has? And what is the worker's opportunity for profit or loss? We saw a lot of issues with this, even with the last recession. People would lay off employees and then hire them back at the same job, but as an independent contractor. Generally speaking, the guidance is if that employee or that independent contractor is doing what your work, what your business does, they cannot be an independent contractor. That is generally the threshold that is decided and measured when these cases come forward. So there's 3 guidepost factors as well. The amount of specialized training or skill required for the work that the potential employer doesn't provide, the degree of permanence of the working relationship, focusing on the continuation and duration of the relationship, weighing toward independent contractor status, if the relationship is definite in duration or it's sporadic, whether the work performed is an integral part of the work. So why is this issue, you know, with independent contractors? Why the big focus on this? So the DOL and the IRS, you know, feel that independent contractors don't have critical benefits, which is true. They don't have access to these benefits and protections as other employees do. They're not subject to minimum wage and overtime laws and any medical or family leave laws. Workplace safety, I should say family and medical leave at the federal level. Massachusetts now, independent contractor could pay into mass paid family medical leave. They're not subject to OSHA, any workplace safety laws, any civil right laws, unemployment insurance, workers' compensation, Affordable Care Act, and the right to unionize. So that's why there is such a huge focus on this. Also, there is a huge loss of tax revenue. So studies estimate that the federal government loses between $2.7 and $4.3 billion annually because people are being paid as independent contractors. Millions in the annual loss of tax, unemployment, and workers' comp revenue. Massachusetts estimates 278 million they've lost, Illinois 266 million, Ohio 498 million. So if you do hire independent contractors, be very, very cautious about that and make sure they are not, they should not be categorized as a W-2 employee. So let's talk a little bit about the California standard. This again may be adopted nationally. We're seeing movement on that at the federal level. So a person is an employee in California rather than an independent contractor unless, number one, the person is free from the control and direction of the hiring entity in connection with the performance of work, both under the contract for the work and in fact. Number two, the person is performing work outside the usual course of the hiring entity's business. For example, if you have an office and you hire a cleaning company to clean your office while you're not there, that would be okay. That would be an independent contractor status. Or you hire a landscape company to clean up the outside of your building. Again, no problem with that. That's an independent contractor status. The third here is the person is customarily engaged in an independent trade, as we just mentioned, occupation or business of the same nature that involve the work performed. So again, if they're doing the work that your company is doing, they cannot be an independent contractor. So here are some red flags. Don't classify individual workers or former employees as independent contractors. Don't engage independent contractors to perform the same work as your employees are currently performing. Don't engage an independent contractor full-time or over a long period of time. Don't prohibit anyone, an independent contractor, from working for another company. You should not be providing training, instruction, otherwise attempt to control how the work is performed. You should not provide them tools, equipment, even a shirt with your company logo on it. Don't reimburse for business expenses. Don't conduct any performance reviews. Limit the review of independent contractors' work to safety, quality, and compliance with contract specs. So really pay attention to these red flags. If you see any of these, do not classify them as independent contractors, put them on your payroll. We talked a little bit about, again, federal OSHA. As you know, it's been very quiet during the pandemic. Federal OSHA really hasn't come out with any guidance at all. It's been on a state-by-state basis. There's 5 states in the US that have come out with guidelines from their state OSHA. So change from the feds is likely to come very soon and will likely follow regs promulgated by California. Guidance was supposed to be promulgated yesterday or Monday, so I'm waiting to hear what is coming. In California, every employer must establish a COVID prevention plan. So Cal OSHA, the head of Cal OSHA, was hired by the Biden team and is now heading up Fed OSHA. And that is why we think that this guidance is coming. So there's a couple of exemptions in California. Employers that have employees who do not have contact with other people, you don't need to have a plan in place. Also, if you have employees working from home, employees who work at healthcare facilities covered under the Airborne Transmissible Disease Act, that's in California. The COVID plan that will be released will require all employers to develop a COVID prevention plan. In that plan, you're going to need to identify and evaluate and correct any hazards that you see in the workplace. If you do have cases, there's a whole investigation that has to happen, and the guide will go over that. Provide exposure notification to employees who've had close contact. You're going to have to describe that in the plan. Correct any hazards. You're going to have to train your employees and have a reporting mechanism. So all of that is going to have to come into play for all employers who have employees working together. So I just wanted to go over with you a couple of items in regard to employment that were just released by the stimulus, and this is in regard to COBRA continuation coverage. So a period of 6 months starting April 1st and ending September 30th. 100% of the cost of COBRA premiums during that coverage are going to need to be covered by the employer for anyone who's involuntarily terminated. So if there's a layoff or a reduction in force, COBRA subsidy is going to be 100% covered by the employer, and they will be getting a tax credit, on the back end for the cost of this plan. So just have that on your radar. Dependent care flexible spending account did increase from $5,000 to $10,500. So if you do have children in daycare or childcare, you'll want to consider that and consider if you increase the amount that you're putting in there. So that is the end of my presentation today. This is my contact information. I don't know if we want to open it up to any questions.
Karyn, thank you so much. It was wonderful. We have a lot of questions in the chat. I do wanna. I'm gonna read some if Jay or if you prefer to unmute yourself and ask the questions, or I can just read them. How would you prefer doing this?
Whatever you like. So I have a
Yeah,
lot of questions.
perfect. Yes, I will rather you ask directly to our expert.
Excellent. So thank you guys, Karyn. So I'm with Neighborhood Health Plan of Rhode Island. We're very focused in on kind of obviously the impact in health care and how all this vaccine works. So we just prepped a presentation for our CEO to determine, can we mandate the vaccine, right? General consensus is yes. But the second question is, should we mandate the vaccine? And so I think that's an important second question. During the first part of your presentation, you talked about returning to work a lot. I don't know about the rest of you, but I've been working my butt off. So it's not a return to work, but a return to workplace or return to the office. And so you can still work even though you're sick or have COVID, right? So I know that's semantics, and I apologize for being the pain in the butt to call that out. But just a thought there. One of the questions, though, that we had was, so the EUA, the Emergency Youth Authorization, how does that impact the ability to mandate? And so I know the Department of Defense, for example, is saying we're not going to mandate under the EUA until we get a formal, authorization through the FDA.
Yeah.
Right. So does that have an impact there?
I don't think so, Jay. I don't think so. I think that as an employer, you just need to decide what risks you have mandating and how you're going to handle that with your staff. I don't know your office, whether you have people coming in like a clinician to be seen at a medical facility, or if it's sort of your corporate office. And that may be, you may want to make a decision based on that, maybe one for clinician offices, and if people are being seen, maybe that makes sense, a business necessity to mandate those locations have the vaccine. But now we're in a corporate workspace, maybe it doesn't make sense to mandate it there, but strongly recommend.
Okay, great. Not sure if you're aware, but there's a couple different legislative proposals that have been pushed through. The first one was, if you got your vaccine out of your turn, right, that's going to be a criminal offense. Now that kind of died on the vine, but there's a new one out, House Bill 5989, that was proposing that businesses cannot mandate the COVID-19 vaccine as a condition of employment. Do you have any faith that will continue to progress through or pass, or do you think that's just more of a politics show?
Yeah, so as we talked about that court case in Massachusetts, right? Do they have the ability to do it? They could. They could push that through. I just think there's going to be a lot of pushback on that. I think that there's some people that really have medical issues that cannot get the vaccine, that are going to be, it's going to be problematic, I think, if we decide to take that tact. I'm just not sure that's the right approach outside of a prison environment, a healthcare facility, a nursing home. I'm just not sure that's the right approach.
Yeah, and which kind of leads me to that second point of the EEOC, at the beginning of this year had proposed changes to the wellness incentive program, and they were really pushing, right, to withdraw some of the support of incentivizing wellness programs. Now, I believe that was rescinded since then, but do you think that would have any additional impact on how we incentivize the COVID-19 vaccine?
I think if we just use nominal amounts, I think you're going to be fine. I think that if we start increasing, I'm going to give you a $500 bonus, Jay, if you get it. That's going to get us into trouble. But I think if we, want to be supportive of our staff and say to them, look, I appreciate you going to get this. I'm going to give you, half a day PTO, whatever that looks like. I think you're going to be fine.
Yeah. And so does that impact any of the GINA requirements?
I haven't seen any discussion about that anywhere with the legal teams that I'm involved in. I've seen no issue with GINA coming in play here.
Okay. For everyone else, that's not Raimundo, right? That's Gina, the Genetics Non-Discrimination Act. And then I think my last question is, I just want to call out again the risk to culture about mandating a vaccine. So our organization, predominantly women, a lot of those are within childbearing age, so the pregnancy has a lot of impact there. But we also have a lot of people of color, and so we know through the research there's a lot of hesitations within those community. So we have been waffling about, is it worth the safety to make sure everyone gets vaccinated that we come in contact with, and is that worth losing a good portion of our employment staff base because they're unwilling to go get that? And
Jay, you bring up a really good point, and I'm sure Neighborhood Health does an awesome job at this, but I know the state has been putting out public service announcements. I've gotten several at my house. I think it's communicating and over communicating to our staff, what we know about the vaccines and why we should be getting vaccinated. And, I just, anybody in HR knows this. Whenever we mandate anything to our staff, like, people just go berserk. Like, that's a real risk here. So I want to, my thought is, let's be supportive, let's be positive, let's try to get the correct and accurate health information out to our communities, especially those at high risk. Have an open door policy. If you're concerned at all, come see us. We'll give you the accurate information that you need to have, and not go searching on the internet or something and look at scary things that are not even accurate. Yeah. I think that would be my recommendation.
Yeah, we have the benefit of having obviously doctors and nurses on staff, and we've greatly had, we've got great turnout. We have a weekly, Ask Dr. Audiano session, which is the guy you see on all the neighborhood ads and commercials and radio. That's been really helpful for us, at least, to change the hearts and minds campaign about getting the vaccine. So just a recommendation to call out for others. See if you can find a doctor that would be willing to do Q&A for your staff.
I think that's a great recommendation, Jay. You're very fortunate to have them.
Indeed.
Anybody else has any questions? This is the time. And again, I will be emailing all of you Karyn's information. I strongly recommend you, if you didn't have a chance to really ask your questions because you're camera shy, you feel your question is not as important, I definitely recommend you reaching out to her and her team so you can get more answers to your questions. Is there any other questions?
Yeah, thank you for mentioning that. We're here to help you through this. As you know, this is a very technical area. It's a very serious area that's impacting all of us. So if you do have any questions, please do reach out, and we're happy to help people through this.
Karyn, thank you so much again for showing up, for sharing your knowledge with our members and everyone in this community. We appreciate you very much. And to all of you here, thank you. And I hope you all have a wonderful rest of your day. I posted a 1-question survey. If you all it takes a second to just let us know if we cover what your expectations. I think we're Karyn always goes above and beyond, but I may be biased, and I hope I get to see all of you again when she comes up with something new that we all need to learn. Thank you, Karyn. I really appreciate you.
Thank you very much.
Bye, everybody.
Bye now.